kindly escort our esteemed dignitaries to the dais.
To begin with, the mercy of the Almighty encompasses those who listen to His verses. Salam. We are honored to have our dynamic head of the department and chairman of the organizing committee, Dr. Devdas Rai, to deliver the welcome speech, setting the tone for this enlightening event. Thank you, sir.
Pro Vice Chancellor Mahe and presently member of the Kanachur Health Sciences Advisory Committee, Dean Dr. Professor Dr. Shahnawaz Manipadi, Medical Superintendent, Medical Superintendent, Kanachur Institute of Medical Sciences, Dr. Harish Shetty, Chief Administrative Officer, Kanachur Institute of Medical Sciences, Dr. Rohan Moniz, Secretary, Organizing Secretary of this CME, Dr. Srikanth Hegde, and distinguished HODs of Medicine, Faculty of Kanachur Institute of Medical Sciences, students and delegates. This is the 4th year the Department of Medicine is organizing the Kanachur Institute of Medical Sciences Diabetes Update. Now, why diabetes? Many times I have been flooded with questions from various people, our faculty, colleagues and all those. Why do you stick on to diabetes? You can have hypertension, you can have fever and all those things. The idea is diabetes is one of the most, one of the important health concerns of the world. And our idea is we want to do it every year on diabetes in various aspects so that it's a brand, the Kanachur Institute of KIMS Diabetes Update becomes a brand. So the theme for this World Diabetes Day, that is November 14th, is Breaking Barriers, Bridging Gaps. So the idea is you have to break the barriers, especially in the diagnosis, and bridge the gap. So the word WHO says that all sections of society should not suffer because of the lack of resources and all those things. So we are working very hard towards that, the WHO. And also statistics, of course, later on many of the eminent diabetes endocrinologists will tell us the statistics are quite alarming. India, there are about 77 million cases, adult diabetes, and that is the tip of the iceberg. All of us know that there are many more cases, and by 2045, the number of cases of type 2 adult diabetes in India will be alarming. Similarly, all over the world also, 537 million cases of type 2 adult diabetes and that is going up. So we need to focus more and more on the various aspects of diabetes. Now, in his absence, of course, our chairman was he was in fact wanted to come because I told him that Dr. Prasanna Kumar is coming, but unfortunately he had another engagement in Mangalore. So in his absence, I would like to welcome Dr. Haji U.K. Monu, the chairman of Kanachur Institute of Medical Sciences. In fact, he is the one who encourages all the departments to have these CMEs and various teaching programs. I welcome him in his absence. I also would like to welcome the dynamic director, Mr. Abdul Rahman, who is away in Bangalore on official work, and he has expressed his inability to inaugurate he is the one all the department HODs know, he is the one who actually encourages us. In fact, the management encourages us they sponsor the whole thing. They say, don't take, these pharmaceutical companies and all, we will. So they have sponsored the whole program today. So I'd like to welcome Mr. Abdul Rahman, our director, in his absence. Professor Dr. Prasanna Kumar. In fact, many people were very surprised that Professor Dr. Prasanna Kumar agreed to come here. And his biodata and everything will be given later when he is addressing us. The senior most endocrinologist based in Bangalore, former HOD, Department of Endocrinology, MS Ramaya Medical College. Sir, I would like to warmly welcome you to this CME of ours. We deem it our privilege that you have consented to address the students and later, that is after the tea break. Then we have our Dr. Mohammad Ismail, Professor Dr. Mohammad Ismail, already I have welcomed him, but we have to welcome him. I have to welcome him officially from the Department of Medicine as a KMC observer. Karnataka Medical Council has given 2 credit hours for this CME, and they have appointed him as a KMC observer. So in his capacity as KMC observer, and in his capacity as chairman of the Kanachur Health Sciences Advisory Committee, and in his capacity as Professor of Medicine, Kanachur Institute of Medical Sciences, and in his capacity as a leading physician of Mangalore, I would like to welcome you, sir. Professor Dr. M. Venkatrai Prabhu, senior physician, former Pro Vice Chancellor of Mahi, already mentioned, and the member of the Kanachur Health Sciences Advisory Committee, plus the teacher of Dr. Srinath, Professor Dr. Srinath Shetty, who addressed us. Sir, we welcome you to this gathering. Professor Dr. Shahnawaz Manipadi, young, energetic dean, dynamic dean. So he is there in all the activities. I would like to welcome you, sir, warmly to this Kanachur Institute of KIMS Diabetes Update. Of course, we have Professor Dr. Harish Shetty, the medical superintendent, senior gynecologist. Sir, welcome. Professor Dr. Rohan Munis, he is the man behind all the constructive activities in this campus. We would welcome you warmly to this KIMS Diabetes Update. Dr. Srikanth Hegde, who has worked very hard towards the success of this event. In fact, he has managed things very nicely. We welcome you, sir, to this. Then the panelists, of course, one I already welcomed, that is Dr. Prasanna Kumar, Professor Dr. Srinath Shetty from the KMC, Department of Endocrinology. He gave a nice lecture on thyroid and diabetes. Then there are people who are coming, there is Dr. Latish Leo from Fadumulas Medical College, who will be speaking on diabetic foot. There is Dr. Kiran Revankar from the Department of Gastroenterology, K.S. Hegde Medical Academy, who is speaking on diabetes and gastrointestinal system. So what we are doing is every year we are changing the different things so that the variety should be there. Then we have Professor once Kiran Revankar I mentioned. Then we have Dr. Mohammad Shamim, who is our own neurologist. He'll be speaking on diabetic neuropathy. Then we have Dr. Megha from our Department of Pulmonary Medicine. She'll be speaking on diabetes and lungs. So we have a talk on, already we had a talk on diabetes and thyroid. We'll have a talk on type 1 diabetes and CVS by Professor Dr. Prasanna Kumar. We'll have a talk on diabetic neuropathy by Dr. Mohammad Shamim. I welcome him. He'll be coming, he'll be expected shortly. Dr. Latish Leo will be talking all day, I told, on diabetic foot. He will be joining us shortly. Dr. Megha will be joining us shortly. She'll be talking on diabetes pulmonology. Anybody else I missed, Dr. Srikanth? And there is a quiz also. There's a quiz on diabetes mellitus, and a lot of people have shown interest. I would request maximum number of people to participate in this CME. I would also like to welcome the media. We have Mr. Vasanta Malya. You could please come and accept a rose from Dr. Prasanna Kumar. Vasanta Malya will be covering this in the media and in the TV channels. He is a foremost media consultant of Mangalore, former banker. Sir, he'll come there. He'll come there. We have Karkera, that is from the Spandana TV. Surendra Karkera, please come and accept a small rose from Dr. Mohammad Ismail. And also the photographer, that is official, what's his name? Ganesh. Yes. And I would like, see, what happens is when somebody does hard work, it is better to recognize them. There is one person, other than of course me and Srikanth Hegde and all the other staff members, but there is another person who has worked very hard, Abbas Ali. Dr. Abbas Ali, where are you? PG. He has done most of the hard work. Please come and accept a rose from Dr. Venkatrai Prabhu. Because we have to. Also, I don't know whether Jeril James, Dr. Jeril James has come. He is the one who set up the quiz. I think he is expected shortly. So with these few words, I would like to welcome all of you. In fact, a lot of students are there. Students actually need this CME very much. All the MBBS students are there, and then 180 people have registered for the CME, and quite a lot of you are there. A lot of family physicians are there, our faculty are there, and all those. I would like to warmly welcome you to this 4th edition of the KIMS Diabetes Update, and we promise you that every year the KIMS Diabetes Update will be there. New topics will be taken up, and so that the variety is there, and so keep on participating. Please keep participating in this particular CME. Thank you.
Invitees, guests, esteemed faculty, staff, students, members of the media, ladies and gentlemen, a very good morning to you all. At the very outset, I would like to sincerely appreciate Dr. Devdas Rai and his team for organizing this CME on diabetes update. Dr. Devdas Rai's vision has brought all the experts in the field of diabetes to this CME, and this CME promises an enlightening discussion on the advancements of the diabetes, fostering the excellence in the future diabetic care. Dr. Devdas Rai hosts variety of impactful academic programs throughout the year. He enjoys hosting such programs, and his enthusiasm is really infectious. Thank you, Dr. Devdas Rai, for hosting such fruitful participants and fruitful experience, and I wish that this CMA will be a resounding success, and have a wonderful time. Thank you all, and Jai Hind.
We are privileged to have with us Dr. Ismail, who is a key observer of KMC for today's CME and the head of the advisory committee, to share his valuable insights with us.
Young, energetic and evergreen Dr. Devdas Rai. Ever since I am from my childhood, I have been seeing him like this only. I don't know whether he's taking some anti-aging gene therapy or something like that, and he's becoming younger by the day. And of course, he has done a lot of job for today's, function, and we hope that he will keep doing it forever. And Dr. Prasanna Kumar, he is our guru. He is one of the senior most endocrinologists and diabetic specialists, and all the dignitaries on the dais. Because without much ado, I'd like to start my program. So my program is to see that I am an observer from the Karnataka Medical Council. So I am going to observe every one of you who is going to sleep and who is not going to sleep. Throughout the lectures, you will have to be awake. Now, this CME, continuous medical education, is required because things are changing day by day. And there is no subject which is more important than diabetes, to see how things are changing. 1,500 years before Christ, there was diabetes. In the Epiros Papyrus of Egypt, and they deciphered it, and they found diabetes. 500 to 600 years before Christ, our own Charaka and Sushruta found diabetes. So diabetes is not a new disease. It's been there for years and years. Because they realized that diabetes is there, which was in India, it was called as Madhumega. Madhu means honey, Mega means cloud. The cloud burst. And diabetes means flow through, just keep on flowing through. Now, from what it was to what it is, it's a sea change. It's a dramatic shift from what all happened. Particularly before 1921, for a type 1 diabetes, we did not have anything. Banting, Best, Collip and McLeod. In 1921, Ontario, Canada, they found the first insulin and gave to one of the youngest boy called Thompson, who got the insulin for the first time, and he survived for many years. He did not die of diabetes, he died of some crash. So from what we know about the diabetes to what it is, things are changing. Now for example, insulin, it started with a dog insulin to start with, then it became a poor cell insulin, then it became a bovine insulin, then it became so-called human insulin. Now the latest development is so-called smart insulins. The smart insulins are being developed. They are in the preclinical stages, and about 4 of the nations are taking part: United States of America, Australia, UK and China. This is another insulin, which is nothing but an analog insulin, which is going to be glucose sensitizing insulin. You put the insulin and it will secrete insulin as and when required, not like our usual insulin which we give according to the food and all that. So things are changing as far as insulin is concerned. For almost 100 years now, 1921 to 2021, there is nothing much changes in the insulin. But there are a lot of other changes in the other drugs, particularly for type 2 diabetes. Ever since D. France gave a view in 2008 American Diabetes Association, the so-called ominous octet. Till then we knew only about 2 reasons for diabetes. Now know that there are 8 reasons for diabetes, and we have to attack all the 8. We don't have a drug to attack all the 8 at one. That is why we are using more than one drug, more than one insulin, and so on and so forth. But there are a lot of exciting things are happening. There are monoclonal antibodies developed for diabetes, particularly type 1. And monoclonal antibodies are tepezuzumab. This is being used, and the FDA has already given a clearance for using it on type 1 diabetes so that it can postpone the development of diabetes. We also have insulin vaccines. The vaccines are going to come, and they are also going to prevent diabetes mellitus. And we have now a lot of other drugs, incretins. Now we have twin cretins, GLP-1 agonist and GIP-1 agonist, and a lot of things are happening in the whole of the diabetes, and unless until we know and keep an up-to-date with what is happening around the world, we will not be treating the patient properly. So to treat the patient properly, and to have a lot of empathy with the patient with the diabetes, and if we get a diabetes, what we expect the same thing to be given to the patient who comes with the diabetes, we have to know everything what is happening. And as you all know, diabetes is not just sweet. It is more than sweet. Even if you control the diabetes completely, the metabolic consequences of that may not be completely waived off. Till we have a system by which an insulin which is developing like the pancreatic islet cell. We also have, as you know very well, islet cell transplantation as well. But all these are going on. Every year, the ADA, American Diabetes Association, International Diabetic Federation, our own RSDA, we are going on having, every year we are changing the protocol. We are also changing what is diabetes. It was to be 7.5, now it has become 6.5, then it becomes 7, then fasting sugar becomes 100. The reason why we are going on changing and going on changing the protocol is diabetes is not really well understood so far. We know it. We know better than what we knew about 100 years ago. But next 100 years is going to be entirely different. Because people are now laughing that if I tell you, for a type 1 diabetes treatment was morphine before insulin came. All the children who had a type 1 diabetes mellitus were dying in the ward. Nothing could be done. So what they were giving? They were giving morphine. Now we laugh. So now when we tell people who come after, say, 50 years or 100 years later, they'll be laughing at us for what we are treating the diabetes. So what I am trying to tell you is that continuous medical education and continuous reading the subject and be with the latest developments, what is happening around the world in medicine, is one of the most important factor we require to be a good doctors. That is why we have these programs, and the Karnataka Medical Council is insisting on all these points to say that at least forcibly we will try to read. Thank you very much. All the best.
On the topic diabetes in 2024.
Good morning. Dr. Devdas Rai, Chairman of this meeting, Dr. Shrikant Hegde, who has been Organizing Secretary, dignitaries on the dais, Dr. Shah Nawaz, and staff of Kanachur Medical College, postgraduate, undergraduate, ladies and gentlemen. At the outset, I would like to thank organizers and this medical college for inviting me for this CME. And already the doctor has said what is the importance of CME and all that. Yes, there are CMEs, not only today, from the last 50 years. They were very occasional. Now it is not mandatory, tomorrow it may be mandatory. What type of CME should be there? One-way talk, I give 4 hours talk, you listen and then go, one direction. What is the other one? Interactive one. Where we want interactive. I was in a medical college, asked, what do you want? Sir, for our students. What do you want for students? We don't want lecture. What do you want? Workshop for 3 hours on diabetes, 20 people. Workshop on neurology, 30 people. Workshop on pediatrics for 30 people. Workshop on gynecology. It's a workshop, people are registered, only 20 registered, 21st, sorry, no. They have a skill lab. What I feel, from my experience 50 years, as a student, 30 years as a professor, this is one-way learning. It should be two-way learning. People don't just want knowledge. Sir, Google Acharya knows more than you. It gives so much of knowledge. What do you want? I want wisdom. How does wisdom come? Experience. Sidney D'Souza is there for 4 decades. He was a teacher, professor, administrator. Wisdom comes from experience. So what we want is a skill one. We used to have Sharif Memorial Lecture, 1 week, morning 9 o'clock to 4 o'clock. Professor said, this is not going to help. I am spending lakhs of rupees, 20 minutes and they go to Delhi, Bombay. He said, I'll get one speaker, 8 o'clock to 9 o'clock, you have a case discussion. Professor, 9 o'clock to 11, 2 hours, you have lecture for PG. 11 to 1, you have lecture for staff. 1 to 2 lunch, 2 to 4 again, another one. 8 o'clock we have dinner and you talk discuss. You get one faculty squeezing from morning 8 o'clock to evening 8 o'clock, 12 hours. My principal said it is time effective, cost effective, and we selected the best in the country. Neurologist, cardiologist, whoever it is. So you have got UG, you have got PG, you have got staff, you have undergraduates. For everybody it was done. So that is one thing, and also have a skill on particular. When I had this workshop, I said, how many have seen glucose meter? No, sir. MBBS student, do this glucometer. How do you know CGMS? Check what it is. There is a recent skill one. 80% of people who have passed MBBS have never given injection. MD medicine, 60% don't know how to draw blood. Right? So this is what it is. Even checking BP. Let me see how many people know how to check BP. Today it is not qualification, it is not knowledge, it is skill. Whether it is medicine, dance, drama, whatever it is, if you have a skill, you will survive. Oh, you did MBBS, your life is done. You have done MD? No, sir. Unless you have a skill. What most important skill is communication skill. Sir, you are the best doctor. Who can judge you? The way you talk, patient decides good. Just because I talk good, I may not be a good teacher. I may not be a good doctor also. So what we need to say is impart this skill from first MBBS till you pass MD or DM. And diabetes is very important. When you are a student, they said, if you know syphilis, you know medicine. Then they said, if you know tuberculosis, you know medicine. Today you say, if you know diabetes, you know medicine. Every aspect of medicine is covered in diabetes, including cancer, how it is. So that is why my own plea is, this is my humble request, rather than 20 faculty, 8 hours, tell me honestly, I can talk 4 hours. Can you listen 4 hours? No? If I talk 15 minutes, 5 minutes you see who is Prasanna Kumar, how he is talking. Next 5 minutes you see what he is talking. After that, switch off. So this is what it is. And whatever knowledge you learn, if you switch off all this light, what you learn in the dark cannot be practiced tomorrow morning. What I want is what you learn today, Saturday, should be utilized Monday morning. Translational research. A knowledge which is useful. I gave my talk 30 years back on type 1 diabetes. 1988, old man came. Very good, excellent ornamental talk. Useless. Nothing will happen. I got angry. Who is this old man talking like this? Sir, he is the senior most doctor here in Kerala. He said, whatever you are talking 30 minutes, nothing will happen 30 years. 50 years, nothing happened. And that is what is wisdom, what he said in 1988 is to 2024 also. So what we want is wisdom, what we want is skill, because if I give all of you some instrument, glucose meter, CGMS, insulin pump, see it, touch it, feel it, use, then you will never forget that, rather than a didactic lecture. So that is what I feel CME should be. Thank you once again. I wish you all the best.
We have the honor of acknowledging Dr. Mohammad Ismail Jamadi, our dedicated KMC observer. To express our gratitude, we would like to present this memento and certificate as a symbol of appreciation. I request Dr. Shanawaz Manipadi to hand over this token of gratitude.
A very good morning to all of you. It's my pleasure to give the word of thanks today. I sincerely express my appreciation to Dr. Mohammad Ismail sir, who is the KMC observer today, and also he is our professor of medicine, and he is the head of the Kanachur Health Sciences Advisory Committee. He gave us a picture about how the diabetes evolved, what is the importance of World Diabetes Day. So I thank him for this. So we're deeply honored to have with us Dr. Prasanna Kumar. He is the first endocrinologist of Karnataka. That's good to know. And also he made his time to be with us. So his contribution to the society, both for the medical fraternity and also for the general population, is remarkable, and also his experience in the subject is very vast. And it's going to be his talk about type 1 diabetes and the cardiovascular risk, about how to prevent the cardiovascular risk in type 1 diabetes is going to be very useful for us, I'm sure. So your presence and contribution have greatly enriched the program, sir. And we are truly inspired by your pioneering work in endocrinology. So we are grateful for making your time to effort and to be with us. Thanks a lot, sir. Thanks for coming. I would like to thank our Dean, Professor Dr. Shahnawaz Manipadi, for your insights and importance about observing the World Diabetes Day. I thank you, sir. We also acknowledge the gracious presence of our staff, Professor of Medicine M.V. Prabhu, sir, and our MS, Professor Dr. Harish Shetty, sir, and our Chief Administrative Officer, Dr. Rohan Muni, sir, in this inauguration program. Thank you, sir. Of course, the important resource persons of today's topic, today's CME, we have three of us here. Dr. Rishina Shetty has already delivered his lecture. I thank you for your valuable time, sir. And also I thank Dr. Latish, sir, for being with us today. I would like to express my sincere appreciation to our Professor HOD of Medicine, Dr. B. Devdas Rai. His dedication and driving the initiatives and getting these things done and giving a very valuable feedbacks has helped us to grow further. His encouragement motivates us to strive for excellence, and his humility makes him very approachable and admirable. It's a privilege to have such a dedicated and compassionate leader among us. So thank you, sir, for your all the things what you do. I thank all the teaching and the non-teaching staff of Department of Medicine for making this program a very successful one. Also, my gratitude goes to all our supportive staff of the catering department, or the IT department, or the project department, housekeeping department, and for making this hall arrange for this particular program. Our sincere thanks goes to our media friends, Sri Vasant Malya and Sri Surendra Karkera, for your presence here and covering this particular event from your point of view, so that you can spread the world, so that this awareness about diabetes spreads across. So I thank you for your support, sir. Thank you. Last but not the least, I'd like to thank all the delegates who have come from all different parts of South Canara district, and also other delegates, practitioners, senior faculties of the various colleges, postgraduate students, interns, for taking part in this program. I thank you. To everyone who have contributed in any way, the event is a testament for what we can do when we work together. And I'm deeply grateful for each one of you for your contributions. Thank you. Jai Hind. Thank you.